Hello everyone. Just going to be going over some common disorders of the eye. We're going over 4 topics today. We're going to be going over retinal detachment, glaucoma, cataracts, and macular degeneration. First, I want to review the basic anatomy of the eye. So, first off, we have the optic nerve here. This is what sends all the signals from the eye to the brain. And we have the retina, which is what transfers the light into a impulse to the nerve. We have the iris, which is basically the color of the eye, which this patient has blue. We have the lens here. That's what filters and focuses everything that the person sees. We have the pupil on the very end of it, which is used for focusing. And we have these ducts. We have one here and one here. First, I'm going to go over retinal detachment. This is a common thing that happens in either injury or a genetic issue with geriatrics. It's where a air pocket or basically the retina detaches from the back of the eye. Typically it can be seen as a air pocket or a fluid-filled sac. There is no pain with this specifically. Patient can see floaters in the vision, some flashes of light, and a curtain effect. This is diagnosed by dilating the eye and looking for fluid or air underneath the retina using a lens. Treatment for this is to inject a air bubble into the eye and placing the patient in a prone position, which uses gravity to push up the retina to then reattach the retina back to the back of the eye. A nursing intervention we can do is encourage frequent eye exams to ensure that if this does happen, that the patient can get that fixed right away before it becomes any worse, leading to a tear. Next one I'm going to go over is cataracts. This is a very common disorder for individuals that are in their late stages of years. Patients can be seen with blurry vision. The eye looks cloudy, which is due to the clumping of proteins, as the lens is made up of proteins and fluid from the eye. We can diagnose this by looking under the eye with a low power microscope, or if it's severe enough, you can see it with the naked eye as a white or cloudy eye. As explained right here. We can try to reduce the problems a patient has with corrective lenses. This will kind of clear up things until it gets to a point of this, which is very late stage. Or we can replace the lens with a new lens via surgical methods. However, that's very extensive. For nursing interventions, we would want to monitor and make sure that the patient is eating a proper diet to try to reduce the progression of this as much as we can. Next, we have macular degeneration, which is where the patient has loss of central vision, and it's basically the retina has blobs of degenerative segments, we'll say. We can diagnose this with dilating the eye and using a grid test to identify curves or wavy lines within that grid test. And this is what a person with macular degeneration can see. You see they have a loss of central, but they can see everything around it. There's a treatment such as supplements or an anti-VEGF agent, which reduces the progression of macular degeneration. We can also encourage a balanced diet for understanding intervention. Diet is everything with the eyes. Next we have glaucoma, which is an interesting one as it has a lot of identifiers, but the main one is halo vision. They also have no peripheral vision or little, can lead to blindness and loss of vision. We have two types here. So the fluid within the eye, we have the duct here. There's an open duct, but it's clogged. So the fluid will build up right behind the outside of the eye, but in front of the color of the eye here. But this is blocked but slightly open, so it builds up here. We also have a closed duct, which is completely blocked, so it'll overflow completely, which is pretty severe and can cause rapid blindness in an individual due to eye pressures. To diagnose this, we can dilate the eyes and measure for pressures, or also known as tonometry. Treatment for glaucoma, we can drain the fluid with a laser. That's usually done by a physician or an ophthalmologist. We can also clear the duct using eye drops. This is kind of a common thing for early stages of glaucoma and seen in a lot of individuals. We also want to try to promote the patient seeing ophthalmologists to ensure that any interventions can be done to help reduce the progression of it. I have my references page here.